So this is a what to expect video I wish I'd seen 2 weeks ago before my emergency appendectomy. But I figured it was as good a topic as ever to cover, especially right now because I just had the surgery 2 weeks ago. It's still fresh in my mind. I'm still recovering, and hopefully I can shed some light on appendicitis, the surgery, and the recovery time. Appendicitis can be a tricky diagnosis just because there's so many things that can mimic it, especially for women. There's just a couple more variables. For men, it's a little bit more straightforward. If you're having that pain in your lower right abdomen, it's usually the first thing that comes to mind. For me, I have a history of ovarian cysts, so it was a little bit more unclear. The pain was so sudden that their initial reaction at the hospital was that it was an ovarian cyst that had ruptured, and the rupture had caused such irritation and that internally that was the source of the horrible pain. It turned out I had both. I had a ruptured ovarian cyst and appendicitis and enteritis, which is an inflammation of the small intestine. But obviously they wouldn't have known that unless they did the surgery. So initially I was admitted on a Monday night, and they wouldn't give me anything for the pain because they didn't, which was excruciating. But I wasn't allowed any painkillers because they didn't want if the pain had gotten really bad, they didn't want the painkillers to dull the pain enough for me to not know if my appendix had ruptured, basically, which I guess was responsible of them, but horribly, horribly painful at the same time. When the surgeon finally came to explain to me about the procedure and get my medical history, it was about 18 hours after I'd been admitted, and at that point I was crying. I was in excruciating, horrible, unrelenting pain. I hadn't been able to eat, I hadn't been able to drink, obviously, because I was going into surgery, and I hadn't been able to have anything for the pain, so I would say those were easily the worst 18 hours ever. But I was actually very, very hopeful and incredibly relieved when I saw the surgeon come in and say he was going to do the surgery, because at that point I wanted nothing more than to get this over with and get the horrible, horrible pain done with. Anytime you wake up from anesthesia, obviously it's expected that you're going to have probably a few side effects, the main one being drowsiness. I still feel it. I still feel a little bit drugged. I still feel a little exhausted, but that also comes with Lyme. For the first week and a half I was super depressed. It's really important to remember that anesthesia is a depressant, and your body has been through a trauma. Surgery is trauma. You shouldn't expect anything from your body for a while. You should just let yourself heal, and the whole thing is, it's a trauma emotionally, it's a trauma physically, but anesthesia is a huge, huge depressant. Obviously it shuts down your whole body, so those side effects are to be expected, and you shouldn't be freaked out if you experience them. The couple nights after my surgery, I was experiencing some nausea. I wasn't able to eat. I was experiencing some discomfort in my right shoulder, which is, they say, from the gas they use to blow up your stomach so they can see it properly. I was just not comfortable overall for, I would say, 5 nights after. Nights are the hardest for me. with my Lyme symptoms and post-surgery, it seems, as well. But there's a couple things that can aid your recovery. There's a couple things that I didn't know before that I know now. One of them is you want to make sure that you're moving your legs enough, because you're prone to blood clots after surgery, especially major abdominal surgery. So when I was in the hospital, they gave me these really cool like stockings that I have a picture of somewhere that I could probably show. And they went up my calves, and they inflated and deflated and inflated and deflated constantly for the whole time I was in the hospital, which obviously would stop any blood clots from forming. So that will probably be done for you. But after the hospital, it's really important to move around, walk around as much as you can, as much as you're able. Not only does it help with the possibility of blood clots forming, but it also gets the gas out of your body, and it also aids your body in healing, and gets things moving, gets the anesthesia slowly through you. The other one is your throat will probably be sore from the breathing tube. Mine was sore for, again, about 5 nights. Ice chips helped. It was actually the only thing I could kind of eat for a while. So the ice chips helped both the nausea and the throat, actually, but I'll get to the nausea in a second. I found Ricola cough drops or throat drops were the most soothing for me. Tea and throat lozenges were very helpful. It's probably going to hurt to talk because of the throat soreness, as well as it'll probably hurt your incisions, your stomach to talk loudly. I could only whisper for like a week and a half. And the third thing that is super, super important is breathing. Everyone at the hospital told me that people who've just had abdominal surgery are at a very high risk for pneumonia, because anyone who's had abdominal surgery doesn't breathe enough, because it hurts a lot to breathe. It hurts obviously your stomach. But it's extremely important to breathe and try to take deep breaths, because otherwise you're at risk for infection and pneumonia, because you're not breathing enough. They gave me at the hospital this, which is like it's a kind of incentive to make you breathe. It's called incentive deep breathing exercise, and you blow into it, and the higher you go, the more desirable the effect. So I usually only get to the yellow part there, but it's cool. It's just an exercise they made me do for 2 weeks. I'm supposed to keep doing it, but I've forgotten. So the breathing is going to help not only in preventing possible pneumonia, but it's also really going to help push the anesthesia through you. So I can't stress that enough, even though it does hurt your tummy for a while. The last thing I had from the anesthesia was nausea. I'm very prone to nausea, so I was not surprised at all, but it is a huge thing to be expected as an after effect of the anesthesia. I was getting really sick while I was in the hospital. I couldn't eat. They gave me Zofran, which I always know works. I love Zofran, and Protonix, which was helping the acid in my stomach. The pain meds definitely didn't help the nausea. So it was really catch-22, because once I got home from the hospital, it was either be in horrible pain and not experience as much nausea, or be in less pain and experience nausea. So I would say definitely if you can have counteract the side effects of the anesthesia and the pain pills. If you're able to take Zofran or Compazine, or and even if they won't prescribe you anything, anything over the counter like Gaviscon works really well as well. So that was my experience post appendectomy. Overall, appendicitis is something that I didn't think would happen to me, and I wasn't aware of the symptoms and the signs except for right stomach pain. That's pretty normal for me, and I guess a lot of, especially gastro-Lyme patients, but this pain was so localized, so isolated, and so intense that I knew something was horribly wrong. My best advice is, if you're a guy or a girl, anybody, whether you think it's nothing or you think it's something, definitely go to the ER. It's not worth messing around with at all, and the stakes are very high, so get it checked out immediately if you're showing any of the symptoms, and hopefully spare yourself. If it's not appendicitis, then you're in luck, but if it is, trust me, you'll be happy in the long run that you no longer have that organ.
I am certain it